segues into our next question, which Dr. Srisaranukon, you had alluded to in your talk as well. So this question is about how are lymphoma and leukemia connected to each other? And I can understand from a patient perspective, everything sounds like blood cancer. What is leukemia, lymphoma? So, you talked a little bit in your talk about the evolution of cells and cell lineages. So very briefly, are lymphoma and leukemia connected to each other, and what do they mean? Do you want to talk about it?
Yeah, you're calling me out because this is a very confusing question, to be honest, and I have never really figured out a way to succinctly answer this question because it's very confusing. I mean, that's because these names are quite misnomers. Leukemia generally had meant that the blood cancer is existing in the peripheral blood. As we draw from patients' arms, that we can see many, many leukemia cells, very, very evident. In lymphoma, in practicalities, a lot of those patients have large lymph nodes that can see and manifesting as large masses, particularly in maybe the neck or in the abdomen. But as that framework, as was noted in the early days, I'm not even sure when, 50s, 60s, 70s, that framework doesn't exactly mesh with the biology underlying these diseases, and it kind of makes these things almost like a misnomer. So I think of that leukemia, there are two types: the myeloid leukemias, which are a type of blood cell, red blood cells, platelets, and some of the white blood cells, and the lymphoid leukemias, including the B cells, T cells, and even the plasma cells like multiple myeloma. The lymphoid leukemias are more biologically similar than the lymphomas. So we treat them almost similarly. And at the end of the day, the name might not even matter, because some of these treatments are very, very similar. I don't know,
Definitely.
Dr. Senchian, do you have a better way to think about it?
No, I think it is a really hard question. I think one distinction I make, I guess, for lymphoma versus leukemia is sometimes the cells are more mature. So it depends along, as cells are maturing, where that where they sort of make that mistake and start growing abnormally, right? So even among the different types of lymphomas, they actually come and, it depends where the cell, again, how mature was the cell when it made a mistake. So even if you look at the spectrum of lymphomas to myeloma, right? So, you can have cells that are in the lymph node, in the germinal part of the lymph node, we call it the germinal cell or the mantle cell or the marginal cell. And it just happens to be what part of that cell was what part of the lymphoid organism what was the cell in when it started like abnormally replicating, right? For myeloma, it's already became like differentiated into a plasma cell, and then that plasma cell started growing abnormally. So it's all on a kind of a spectrum. And yes, I do agree. Sometimes it doesn't matter. Sometimes it's like a nomenclature rule. So you'll see some places leukemia treats CLL. At my institution, lymphoma treats CLL. The nuances are very specific, like, we call it leukemia because you can test CLL in the blood, right? So it is, part of it is nomenclature. I think also as we learn more about the genetics of each type of cancer, everything changes all the time.
Correct.
So I just like to think of it more, it's like a spectrum of diseases, and it's sort of just where along the spectrum the cell became abnormal.
Absolutely.